Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, this particular study just really resonates with what I see every single day in practice. And there's a lot of times, I'd have to say the bulk of times, people come in with an episode of low back pain and they don't really remember doing anything. But I find that most people have problems because of what they're not doing rather than what they are doing. It's not to say that people aren't, they don't lift up something heavy and turn the wrong way and flare up to low back pain, but sitting on the couch is the worst thing we can absolutely do for any type of musculoskeletal pain. And this study just kind of confirms it. And it was an Australian study, and they looked at a set of 329 twins, and they found that those who engaged in moderate to intense physical activity, or moderate to vigor, but they call it vigorous. Intense sounds like something we want to avoid. But for every minute of this level of activity, there was 2.8% lower risk of a severe low back pain episode. Now, it's not like they counted each minute, but in general, people were doing like 20 minutes a day, something like that. And these were weekly activities. That's not a hard way to lower your risk of low back pain, and we need to be moving anyway. And while this study was on low back pain, you can pretty much guarantee that we're going to find the same thing for neck pain, to a certain degree mid-back pain, a little bit of some different factors with that. But we need to be moving. I always say that athletes are easier to fix. Couch potatoes are notoriously difficult to get better. Because and the way we practice, like we're working on the muscles, the ligaments, the tendons, the fascia, the joints. We get things moving, and the worst thing somebody can do is go sit on the couch and not move. So I would also suggest that if you have a provider, regardless of the letters after their name, that are promoting resting or curbing your activity, that maybe it's time to get advice from somebody else. It's very rare in my practice that I have somebody move less. Granted, within certain exceptions, but it's a very seldom conversation that I have. We have to be careful with how we move, but in general, movement is our friend regardless of what is going on. So if you're worried about low back pain, or you have episodes of low back pain, start moving. I am a much bigger fan of exercising than I am exercises. I find patients that are moving are less likely to have episodes of back pain than are people who are not exercising but doing exercises. So like, hey, I went to this provider and they showed me these exercises and that's what I do. I find that in the long run, those aren't as helpful as just getting out and moving, whatever that would happen to be. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.